I had varicose veins for years and I had to do something about it.
Varicose veins are a common condition in the United States, affecting up to 25% of men and up to 40% of women. Genetics is the primary contributing factor for varicose veins. Other factors include aging, leg injury, and occupations that require standing for many hours. Varicose veins are bulging veins that are larger than spider veins, typically 3 millimeters or more in diameter. Fortunately today, varicose vein treatment usually doesn't mean a hospital stay or a long, uncomfortable recovery.
The treatment for varicose veins has changed quite a bit since I've been practicing. In the past, ligation and stripping was used primarily in the hospital setting. The benefits of endovenous laser treatment and ambulatory phlebectomy is that now the patients can be treated as an outpatient and get up right away and walk, and don't have to be in the hospital and don't have to have stitches or any general anesthesia.
The Florida Vein Care and Cosmetic Center has become one of Central Florida's preferred providers specializing in the treatment for varicose veins. Dr. Richard Bragg is a nationally recognized leader in the field of vein care with more than 10 years' experience and close to 50,000 treatments performed.
The patients that are more likely to get varicose and spider veins are patients that have a history of a genetic predisposition to weak veins, or that have had multiple pregnancies, or have jobs that they're standing all the time. Trauma and sun exposure is much less of a risk.
The reasons why I wanted to have my varicose veins fixed were my legs were tired, and so tired that I didn't even want to take walks. And they hurt, they were swollen, they felt uncomfortable at night in bed, and they looked terrible.
Hello, Joan. I'm Dr. Bragg. Nice to meet you.
No one likes to go through an operation, but I was glad I spoke with Dr. Bragg. He told me about a non-invasive procedure.
In Joan's case, we examined the legs in a couple different methods, but we used the gold standard, which is the ultrasound machine. Once the ultrasound has shown us where the leaks are in the veins, then we're ready to proceed to the ambulatory phlebectomy and endovenous laser treatment. The vein lab allows me to see beneath the skin and outline the veins with a surgical marker. Now that the markings are done, we can use these markings during the surgical procedure to remove only the veins that are leaking. Now we use the ultrasound to mark the perforator vein, which is where the main leak is coming from. So the next step is to numb the area where the leak is. Then we'll bring the vein up to the surface, slide the laser fiber inside of it, and then seal the leak with the heat from the laser. The patient's awake, so we're just using local anesthesia. Now that the skin is numb and the veins are numb, a 3 millimeter incision is made to allow access to the varicose veins. The tip of the laser has an aiming beam, a little red light, so you can see that through the skin. And give the patient a little more numbing medicine. You can see that under the skin. We can use the ultrasound again to see the tip of the laser.
90.
So now the laser has sealed the leak. We double check one more time with the ultrasound to make sure the deeper veins are still flowing properly. Then we don't need the laser anymore or the ultrasound. We're going to repair the damage that the leak has done over the years by removing these unnecessary veins. These veins are just a reservoir to pool blood, and that's what gives the patient either swelling or discomfort, aching. Now the veins are removed slowly. small segment at a time. And here's a small segment of vein that's removed from a 3mm incision. How was the procedure for you, Joan?
That was fabulous. I mean, I didn't even feel anything. I didn't know anything was going on. It was great.
Good. Well, we'll wrap it up as soon as we get you cleaned up.
These are the multiple incisions that were done by Dr. Bragg, and we put steri strips on them. They don't need any stitches. And on top of this will be a series of wraps and then the compression stocking. Patient is to leave all of this alone until a week from today, wherein we will take the dressing off.
This bandage and stocking stays on for 7 days without coming off. And the patient will have a plastic sleeve that goes over the whole thing so they can take a shower. You're going to walk every day.
Okay, sir.
Half hour or so. Today you're going to walk as soon as you get up. You'll walk outside. Well, you can get up and down and do your errands around the house and stuff.
Okay.
You don't need to go out and walk a couple blocks or a mile today. You already have done it today.
Okay.
Tomorrow you get in another 20-30 minutes. And the next day, if you want to walk longer, it's okay. It's important to walk after our procedures because it helps prevent any blood clots. It also will help flush out the medication that we put inside the vein if it's a sclerotherapy. So the sooner it's flushed out, less side effects, less chance of any blood clot. As you walk, the blood that's inside the veins will move out, more likely that they'll seal shut and stay shut. So that's why we do the walking. Hello again, Joan. Now that we've taken care of your large varicose veins and it's been about a month, we can start working on the spider veins. Many patients are concerned about the cosmetic veins, which are called venules, spider veins, or feeder veins. And those veins don't have to be treated in a surgical approach. They can be treated with small injections called sclerotherapy. And this is a procedure that is done in the office. Patients get up and walk immediately afterwards. And it's done in several sessions, usually 3 to 5 sessions, about a month apart. And with sclerotherapy, we're actually putting a sclerosant medication inside the vein that irritates the lining of the vein, makes the vein seal shut. And what you see here is these are feeder veins, the green vein right here, that feeds into the purple veins. And these would be spider veins. Typically the patient is more concerned about the purple veins, but if you don't treat the feeder veins, you're not going to have very good results on the spider veins. So we'll go up to the feeder vein, right? Little stick. And you can see those shrink up right away. You see the green disappear. So that's the clear fluid replacing the blood. That's why you see it go away there. So watch this one disappear. So you remember that area that was purple? Now it's starting to fill back up, and it takes about 4 weeks for that to heal and go away.
I'm so glad that I had this procedure done. It was a lot easier than I thought it would be.
Dr. Bragg has had excellent long-term results using the minimally invasive options for vein disease. There's no way to completely prevent varicose veins, but improving your circulation and muscle tone can reduce your risk of developing varicose veins or getting additional ones.